have any problems getting here?
The direction was a bit hard to find, but the traffic was really good. Thank you.
Okay, well, I'm Dr. Andrea, and I'm a cardiologist, and I'm gonna help you today.
Nice to meet you, Eduardo.
Okay, so, well, first, since this is your first appointment with us, I'm gonna ask you some questions. What's your first and last name?
My first name is Eduardo, and my last name is Salazar.
Okay, how old are you?
I am 20 years old.
Oh, good. And what do you do for a living?
I am a student of medicine, and I also work part-time at a convenience store to fund my studies.
Okay. Do you frequently feel stressed?
Yes,
Because of that?
It's very demanding with my career as well as having to go to work, especially during exams.
Okay. And are you married or something?
No, I'm single.
Okay, nice. So, well, now tell me, how can I help you?
I have been feeling this headache as well as a rush in my arms.
Can I say?
Yes.
Okay, yes.
I also had some pain in the joints, especially during the mornings. And I feel like a twitch in my finger. And also I've been coughing a lot lately.
Okay.
So I don't know what I may have right now.
Okay, how is your cough? Is it productive?
It has a white liquid in it.
A white
I don't know
liquid?
what it is.
Okay.
It's really worrying.
Oh, well, I'm gonna help you. So, have you taken any meds?
I've been taking medicine for the headache. And some...
Do you remember the name of the medicine? Or like, no?
I believe it's just like for pain relievers.
Okay.
And also pain relievers for the joints. But I don't know what to do about the rash.
Okay. So, well, now I'm going to ask you some information about your family history in order to see if there is any relationship between your condition and your family history. So, do you have any family with diabetes or hypertension or something like that?
Diabetes my grandfather had. As for hypertension, many people in my family have, especially the males. And any other disease you want to know about? So,
well, have you had any important surgery in the last year or 2 years?
In the last 2 years, surgery, no, I've been having, I had a disease like last month.
Okay.
It was an infection, just like streptococcus, I believe, and the doctor said or something.
Did she or he said something like scarlet fever?
Yeah, that was it.
Okay. And what did you take for that?
I can't remember the medicine, but I was given some medicine. I think it was antibiotics.
So how long were you sick for?
I think it was for 2 weeks. That was 1 month ago, so it's been 2 weeks since I got cured from the disease.
Okay, yes. And after that you started feeling bad again?
Yes.
Okay.
That's more recent.
Okay, and so have you had any other symptoms, like the past 6 months? Like, I don't know, nosebleed or headache?
But that's sometimes. Headache I have right now.
Okay, well, yes. And then, okay, well, and tell me something about your habits. Do you eat like a lot of fat or?
Well, since I work and go to the university, a lot of times I eat like outside in like small food. People who sell food in the street, so maybe that has a lot of fat in it.
And how many liters of water do you drink per day?
Maybe about 1.5.
One, okay. And do you do exercise?
Yes, that's another one of my problems, that I feel shortness of breath when I do exercise sometimes.
Okay, and what do you do for that? Do you stop? You have to stop, okay. And do you feel dizzy?
Yes, also.
Okay, I see. So, are you allergic to something?
Not that I know of.
Okay. No,
there was a medicine that I was given, but I can't remember the name.
Maybe most of the people are allergic to sulfurs.
Sulfurs? Maybe it was antibiotics.
Yes.
Oh, and also, I'm allergic to peanuts and other types of nuts.
Okay. That's really important. Well, now I'm gonna do a physical examination.
Okay.
So I'm gonna ask you to lie down here. Okay, so can you lie down here, please? I'm going to take your vital signs first. First, I'm going to take your temperature to see if you have fever.
Okay.
Okay. So we're gonna wait 3 minutes. In the meantime, I'm gonna check your pulse. Well, it seems you're good. 90 beats per minute. Well, I'm gonna take your blood pressure. Okay. Okay, you have 70/90. Since you have a little bit of hypertension, do you feel a little bit dizzy?
A little bit sometimes.
Okay, and also when you do exercise, right?
Yes, when I do exercise.
Okay,
And I also get the shortness of breath.
okay. Well, now I'm gonna... Can you sit down, please?
Yes.
Okay, I'm gonna check your head to see if... Okay, no, it's not implant. Here, does it hurt?
No.
Okay. Your ears? No, they look good. Your... well, can you lie down? Your nose? Okay, no, it's okay. And can you open your mouth? Oh, well, you have your throat implant.
Oh, really?
We can check out this. Well, you have 38.5 degrees, so you have a little bit of fever. And well, I'm gonna touch your abdomen. I'm gonna press to see if there is something wrong. And tell me if it hurts.
Okay. There it hurts.
Does it hurt more when I press or when I release?
When you press.
Okay. How about here?
No.
Okay. Here?
A little bit.
A little bit? Okay. Here?
No,
Huh?
there you go.
Okay.
There you go.
So now, can you take off your shirt? And I'm going to hear the sounds of your abdomen. Okay? Are my hands cold?
No,
No,
they're fine. Don't worry.
Oh, I think you're okay. Okay, now let me just gonna check your arms. You said you had a rash?
Yes.
Okay, for how long have you been having this rash?
Like for a week, probably.
Okay. Well, I'm gonna give you some creams and meds for this. Do you sometimes have chest pain?
Sometimes I do.
Okay.
Especially when I have also shortness of breath.
Okay, I see. And your legs, can you... So, it seems like here it's a little bit implant, right?
Yes.
Does it hurt?
Well, especially when you press like closer to the joint.
Okay.
Because my joints hurt a lot during the mornings, especially.
Okay. But you didn't take anything today for that, right?
Today no,
Okay.
because I was coming back. Usually I take something.
What do you can do? And here, oh yes, your joints are really inflamed.
Is that bad?
Well, I think that I'm going to need some blood tests and electrocardiogram to see if there is something wrong with your heart.
With my heart.
With your heart, because you have shortness of breath, you have chest pain, and also the blood test because you said that you had scarlet fever 1 month ago.
Yes.
So I think it probably can be a rheumatic fever, and there's a complication of that, and you can have like heart problems.
And is that common?
Well, yes, more or less. And well, but don't worry. I'm gonna need you to take those tests, and well, come here and see me.
Okay.
Okay. Good afternoon. Come in, please.
Hi, doctor.
Hi. How are you doing?
Fine.
Well, I just checked your results, and you have rheumatic fever with rheumatic heart disease.
Oh my god, is that bad?
Well, it's not bad, but you're gonna have to take meds. You're gonna have to follow a special treatment, and I'm gonna explain you a little bit about it. Well, yeah, you said that you had scarlet fever 1 month ago, right?
Yes.
So that's the reason why now you have rheumatic fever.
Oh.
And a complication of rheumatic fever is rheumatic heart disease. That's why you have chest pain. A normal symptom of rheumatic fever is a joint pain, a rash, like the reddish rash that you have, headache, fever, and you really have to take meds now.
No?
Because if not, it's gonna get worse.
Yeah.
Okay, so you're gonna have to take antibiotics.
So it's an infection too?
It's an infection too, yes. For 2 years or 3, okay?
Easy.
And I see that you have hypertension too. So for that, I'm gonna need you to take some blood sugar tests for 1 week. For now, I'm gonna ask you to please eat something with sugar after you exercise,
Okay.
in order so that you won't faint or something like that. So as I said, you're gonna take penicillin and aspirin for the pain,
Okay.
and also you have to increase your exercise. You have to increase your water consumption for your health, because you're gonna be taking antibiotics, and if you don't drink water, your liver is gonna stop functioning. And well, that's all. Do you have any question?
No, but like when I do exercise, like I have to increase the exercise even though like if I get shortness of breath, or do I stop when I get shortness of breath?
No, you have to stop when you get shortness of
Okay.
breath, but you have to exercise yourself like 3 times per week
Okay.
or 4. Yes. And anything else? Do you have insurance for the meds?
Yes.
Yes? Okay, so you don't have any economic issues.
No, that's fine.
Okay. Well,
Well, thank you very
that's
much,
all.
doctor.
No. Call me if you need something. Okay?
Oh, thanks.
And I'm gonna see you in 1 month.
See you, doctor.
See you. Bye.
Thanks.